Hello, I'm Dr. Abella, a partner in South Florida Cardiology Associates and a member of Elite Health. And today I want to talk to you about a revolutionary technology that has just become available for our patients, known as carotid intimal medial thickness, or CIMT. Heart disease is the #1 killer of American men and women. According to the American Heart Association, 50% of men and 67% of women who die of heart disease experience no symptoms prior to their heart attack or stroke. In other words, their first symptom was a heart attack or a stroke. Additionally, medical bills are the #1 cause of bankruptcy in the U.S. An astounding 67% of all bankruptcies are due to medical bills. Why take chances with your health and the welfare of your family when we now have technology that helps us predict disease? CIMT is a safe, painless, FDA-approved test that can quickly screen for and monitor atherosclerosis, the underlying cause of heart attack and stroke. CIMT provides a direct measurement of vascular disease, even in its earliest stages, before it causes symptoms or blocks blood flow. How does CIMT work? The test is a simple, non-invasive 50 to 20 minute procedure done as an outpatient that involves no injections, no pills, and exposes you to no radiation. The test uses sophisticated ultrasound technology and requires expert interpretation, so it's not widely available. The technology was developed in conjunction with NASA and is the same science used to measure water on Mars. As physicians, we currently treat patients based on ATP3 criteria, which are based on population trials and shown to be effective in those populations, but not in you, the individual. Many patients have other risk factors which are not taken into account by the current ATP3 criteria and may fall through the cracks and not be treated at all. Other patients may be treated according to the guidelines, but despite that, they continue to have progression of their cholesterol buildup. CIMT allows us to treat you, the individual, as well as to follow your treatment over time and to monitor your progress, as well as to evaluate the need to modify your particular treatment regimen. One special feature of the CIMT is a report you will receive that compares CIMT results with others of your age and gender, comparing your risk for heart attack or coronary death. Early detection can lead to early intervention. Not only can we save lives, but we can improve quality of life. Who should have a CIMT? CIMT is most appropriate for individuals who are at risk for heart disease based on traditional cardiovascular risk factors, such as individuals who are typically over 40 and have one or more of the following risk factors: family history of heart disease or stroke, tobacco users, diabetics, overweight patients, those who are physically inactive, women in menopause, patients who consume a high-fat diet, patients with high blood pressure, patients with a high LDL or bad cholesterol, patients with a low HDL or good cholesterol, patients with elevated triglycerides, patients with the metabolic syndrome, and patients who are steroid users. Medicare and most private insurance companies do not routinely pay for CIMT, yet CIMT is a safe, FDA-approved test, recognized as a valid means for detecting subclinical cardiovascular disease to assess risk for heart disease. At our offices, we offer CIMT testing and interpretation at a reasonable cost. Request a CIMT appointment by calling our offices or requesting it from your physician or healthcare provider.